Welcome to my presentation on the diseases of the GI tract. This presentation is going to cover two different kinds of liver fluke. There is the oriental liver fluke, and then there is the common liver fluke. And we also have another called a blood fluke. This presentation is going to go over the differences and the similarities between them. Oriental and common liver fluke. Here is some background information between the two of them. Oriental and common liver flukes are parasitic flatworms that infect the liver and bile ducts of various mammals, including humans. They belong to the family Fasciidae and the genus Fasciola. Oriental liver fluke, Fasciola heptica, is found in Asia, Europe, and Africa. Common liver fluke, Fasciola gigantica, is found in Africa, Asia, and parts of South America. Here we are going to be talking about the disease mechanisms for each of the oriental and the common liver flukes, how they are transmitted to one another between humans and other mammals. Liver flukes have a complex life cycle involving snails and various mammalian hosts. The adult flukes reside in the bile ducts and release eggs that are passed out in the feces. The eggs develop into mercadia, which infect snails and develop into spirocysts, radiae, and ceroid. The cerate are released from the snail and insist on vegetation where they can be digested by grazing animals or humans. Once ingested, the larvae exist in the duodenum and migrate into the liver, where they penetrate the bile ducts and mature into adult flukes. The adult fluke can cause inflammation, fibrosis, and obstruction of the bile ducts, leading to cholangitis, cholecystitis, and biliary cirrhosis. Patient symptoms. Symptoms of liver fluke infection can vary depending on the stage and the severity of the infection. Here this diagram shows how a human can go from eating raw or bad fish, and then how that can go into the debris of the raw fish, going into cooking, how you eat the raw fish, and then it goes into domestic animals. Then the domestic animals defecate, and then the snails eat it. It goes for the other side as well. Humans defecate that raw fish, and then the snails pick it up, or other wildlife do. And then you get into the freshwater simpered fish, and it goes right back to humans. So early symptoms may include fever, abdominal pain, diarrhea, and vomiting. As the infection progresses, patients may experience jaundice, hepatomegaly, ascites, and pruritus. Chronic infection can lead to liver cirrhosis, liver cancer, and even possibly death. Diagnosis. Diagnosis of liver fluke infection can be challenging because the symptoms are often non-specific and can be confused with other liver diseases. Laboratory diagnosis can be achieved by detecting eggs in the feces using a microscopic examination or by serological tests that detect antibodies against the flukes. Imaging techniques such as ultrasound and CT scan can also be used to visualize the bile ducts and the liver. The picture behind this is showing what the liver flukes look like in comparison to other microscopic antibodies. The liver flukes are that oval-shaped epidemiology. Liver fluke infections are endemic in many parts of the world. The infection is more common in rural areas where there is a high prevalence of livestock grazing on contaminated vegetation. People who eat raw or undercooked freshwater fish or vegetables have been contaminated with liver fluke metacarcate are at a higher risk of infection. This particular disease is most commonly found in Asia, Africa, and South America. Treatment and therapy strategies. The treatment of liver fluke infection involves the use of anthelmintic drugs such as trisacabindozi, bithanol, and praziquantel. These drugs can kill the adult flukes and prevent the release of eggs, reducing the severity of the disease. In severe cases, surgery may be required to remove the obstructed bile ducts. Prevention strategies include avoiding raw or undercooked freshwater fish or vegetables, and improving sanitation and hygiene practices in endemic areas. Here we are going to be talking about the blood fluke and the differences from the blood fluke and the oriental and common liver fluke. Some background information on blood flukes. Blood flukes are parasitic flatworms that infect the blood vessels of humans and other mammals. They belong to the genus Schistosoма and are transmitted through skin contact with contaminated fresh water. Primarily, they are found in tropical and subtropical regions. Blood flukes are flatworms, and oriental flukeworms are not. And here, the blood flukes infect the blood vessels, and flukeworms infect the intestines. Here we are going to talk about the disease mechanisms of blood flukes. Blood flukes also have a complex life cycle that involves snails and mammalian hosts as well. The adult flukes reside in the veins surrounding the bladder and intestines and release eggs that are passed out into the urine or feces. The eggs hatch into mycaria, which infect snails and develop into spirocysts, radiae, and cilia, and released from the snail and penetrate the skin of the human host, where they transform into citrosomia and migrate to the lungs and liver. From there, they travel to the veins surrounding the bladder and intestines, where they mature into adult flukes. The adult flukes can cause inflammation, fibrosis, and obstruction of the blood vessels, leading to various complications. Patient symptoms. The symptoms of blood fluke infection can vary depending on the stage and severity of the infection, just like the oriental and common liver fluke. Here we have a photo of how the blood fluke infection goes about its life cycle and ends up into a human body. Initially, patients may experience a rash or itchy skin at the site of penetration. As the infection progresses, patients may develop fever, chills, abdominal pain, diarrhea, and blood in the urine or stool. Chronic infection can lead to various complications, including liver and spleen enlargement, bladder damage, kidney damage, and an increased risk of cancer. And here is a photo depicting what that rash may look like. Diagnosis. A blood fluke infection diagnosis can be achieved by detecting eggs in the urine or stool using a microscopic examination or by serological tests that detect antibodies against the flukes. Imaging techniques such as ultrasound and CT scan can also be used to visualize the affected organs and blood vessels. Epidemiology. Blood fluke infections are endemic in many parts of the world, particularly in sub-Saharan Africa, the Middle East, and in South America. The infection is more common in areas where there is a high prevalence of freshwater snails that act as intermediate hosts. People who swim, bathe, or wade in contaminated freshwater are at higher risk of infection. Treatment and therapy strategies. The treatment of blood fluke infection involves the use of anthelmintic drugs such as praziquantel and oxymquin. These drugs can kill the adult flukes and prevent the release of eggs, reducing the severity of the disease. In severe cases, surgery may be required to repair the damage caused by the infection. Prevention strategies include avoiding contact with contaminated fresh water and improving sanitation and hygiene practices in endemic areas. This concludes my presentation. I hope you liked it and learned quite a bit about the differences between the blood fluke and the oriental and common liver fluke. Welcome to my presentation on the diseases of the GI tract. This presentation is going to cover two different kinds of liver fluke. There is the oriental liver fluke, and then there is the common liver fluke. And we also have another called a blood fluke. This presentation is going to go over the differences and the similarities between them. Oriental and common liver fluke. Here is some background information between the two of them.